Yes, so Connecticut still does have the Connecticut Home Care Program for elders. And like I said, that program is designed to keep people 65 and older at home, where most often that's where they want to be. That's where they're the most comfortable and they're going to thrive and be happiest. So the goal is to keep them out of nursing homes and out of assisted living and at home, but with services to keep them at home safely.
Hello, everyone, and welcome to Sounds of Health. I'm your host, Dave MacNiven, and today I'm excited to welcome our guest, Candice Brown, a senior account manager at Careforth. So excited to talk to Candice about everything that Careforth does and has to offer. And if you're here to listen to Candice, please be sure to go back and listen to some of our past episodes. If you like what you hear, you can like, subscribe, even leave us a review. We love hearing from the community that we're building out there as we uncover inspiring stories, highlight incredible people like Candice, and share valuable resources to help you to improve your physical, emotional, and financial well-being. Candice, welcome to Sounds of Health.
Thank you, David. Thank you for having me.
We're so excited to have you. I think this might have been one of the quickest turnarounds from when you and I met to when you actually came on the show. So it was nice that we were able to fit you in here toward the end of our recording season. We're just excited to talk.
I'm honored to be here. So fabulous meeting you. Excited to be here and to talk a little bit about Careforth.
Awesome. So first, let's get started with just getting to know you a little bit better. Tell our audience where you're from, what your story is, what brought you to what you're doing today with Careforth.
Absolutely. So, my name is Candice Brown. I live in Marlborough, Connecticut. I actually grew up in East Haddam, Connecticut. And when I was 9 years old.
Sorry.
That's okay.
Some technical difficulties. Our camera went shooting at the ceiling.
I know, I noticed that, but that's okay.
It started to follow me. I don't know. Maybe it's attracted to me.
It happens. Every time Jason moves, it goes over to him.
Yeah.
Okay. Anyway.
Yeah, no problem. No problem. We make it work.
Yeah.
So as I was saying, when I was 9 years old, my mother tragically had an accident and fell off of our boat and was paralyzed. So I became a caregiver for my mother at a very young age. It was a very difficult journey, learning things that obviously little kids usually don't learn about, having to dedicate my time and my energy to going home and caring for her throughout my whole entire life. With that came so many emotions, a roller coaster of emotions, and the overwhelming feeling of being alone, that nobody, was there. Nobody understood quite what I was going through. So, when it came time to, go to college and kind of discover what I wanted to do with my life, I was kind of confused, didn't know which path to go down. I mean, I knew how to be a caregiver, but I wasn't quite sure that that's where I wanted to end up with my life. So I did go to college and got some degrees that were not in the medical field. But then I ended up being a case manager for the home care program for elders here in Connecticut. And I really just loved that there was a program that kept people at home with services. But my favorite cases were the ones where there was a family member caring for their loved one, because it was such a journey for myself that I could relate to these caregivers. And here I am at Careforth.
That's incredible and amazing. I can only imagine how challenging that could be, caring for a parent at such a young age. So where did you end up going to college?
I did go to Eastern. I started at Three Rivers, a community college in Norwich, Connecticut, and then transitioned to Eastern Connecticut.
And you said you got a couple of degrees. What were those in?
Yes, I got a bachelor's in sociology and a bachelor's in early childhood education. So actually went to be a teacher in the school system, and spent some time there, but it wasn't where my passion was. It wasn't where my heart was.
Yeah. The sociology degree, though, probably helps you in everything you're doing now, right?
Absolutely. Yep.
Yeah. So that's amazing that you ended up finding this path specifically, especially considering the background and the experience that you had growing up. How long have you been with Careforth for?
So I am with Careforth going on 5 years. And before that, I was working under the home care program for elders for 5 years. So I spent around 10 years, working in the community options programs to where people can reside at home, stay at home.
Gotcha. Okay. So this has been a real long journey for you.
Absolutely.
So tell us.
Very rewarding.
Yeah, I can imagine. So tell us a little bit about what Careforth does.
Yes, so Careforth is based out of Boston, Massachusetts, and we are in 10 states with this caregiver support program. Every state is very unique on the caregivers and the regulations and who you can help. So specifically Connecticut, here in Connecticut, we are supporting family caregivers that are living with their loved ones at home, and they are the primary caregiver for their loved one. So Careforth helps the caregiver emotionally, clinically, and also financially. Every caregiver is assigned a clinical team of a registered nurse and social worker, and that is for clinical oversight and education because, as we know, as our aging loved ones are diagnosed with, new situations, new conditions, with that comes new education. And we want to make sure that these caregivers are properly trained and that they feel comfortable and safe with caring for their loved one. But more importantly, we want to make sure that they are taking care of themselves. We want to check in with these caregivers and make sure that they are receiving supports, a connection to resources, that they have backup care aligned for when they do need a break. And then also they get a tax-free stipend. So it's just a very holistic program approach to supporting caregivers.
That's really amazing. I can only imagine how much stress and pressure it puts on people when they're taking care of a loved one like that. So to have a whole support system in place, I'm sure is a huge game changer for them.
Absolutely.
Now, is the home care program that you worked for prior to this still around, and how does that work with what you guys do?
Yes, so Connecticut still does have the Connecticut Home Care Program for elders. And like I said, that program is designed to keep people 65 and older at home, where most often that's where they want to be. That's where they're the most comfortable and they're going to thrive and be happiest. So the goal is to keep them out of nursing homes and out of assisted living and at home, but with services to keep them at home safely. On the home care program, there's many services that could be put in place. So again, when it was my position as a case manager, I'd go into people's homes, I'd do the assessment and kind of create a care plan on what the individual would need to remain at home. So what it's called when a family caregiver is caring for them, it's adult family living. It's just a service that could go on that care plan to support the situation and keeping them at home safely. So that program still is in Connecticut. It's alive and well. There's many, many people applying for it every day. So that is with the state of Connecticut Department of Social Services. They ultimately have to approve people functionally and financially for that program.
Okay, gotcha. And then what does it take to be approved for Careforth?
Just having the consumer, the patient approved for the home care program for elders.
Okay, so that is step one.
Yep.
Okay.
Yep. And we make that referral to the home care program. We make sure the assessment's scheduled. We navigate and support them through the approval process with the state. And once the patient or the consumer, the loved one is approved and, the family caregiver wants to be the primary supported and paid caregiver, we could start services right away.
That's amazing. And so for this to work, it does need to be a family caregiver, correct? Somebody who lives with them in the home?
Yep. So it could be a family member or a friend.
Okay.
In the state of Connecticut, it cannot be a legally married spouse. So that's very important for people to know. But, many people are caring for their aging parents, their grandparents. So those are the situations that we really want to identify. They do have to reside together in the same home. There's always proof of address and then a background check done on every caregiver as well. Caregivers have to be 18 or older. But other than that, that's the only criteria.
That's amazing. How does the support system work once it's in place?
So our care team will initially go out physically into the home. They will sit down with the family, the caregiver, go over, their backup plan, any kind of resources that they may need immediately. And they also train them in our app. So this is a way that we are communicating with caregivers in between those in-home visits. So it's accessed through a smart device, and very important, if caregivers don't have a smart device, we will actually get them set up with an iPad to get that app started. Through this app, they can contact their care team like in the moment. So it's like kind of like phone a friend,
great.
phone a family member. Yeah, it's awesome. So something happens with mom or dad, last night or today, and you're kind of like on the fence of what to do. They can contact their care team. And many times we can navigate the situation without the individual having to go to the emergency room or the hospital. So, just a great clinical outcome is this program is decreasing hospitalizations, ER visits, and falls, which is really great and
So important, yeah.
Yep. And caregivers, through this smart device, they can also, or through the app, they can have, med reminders, appointment reminders. There's a library filled with content to support them in caring for their loved one and also to care for themselves.
Wow, that's incredible.
Yep.
So what are some of the biggest challenges that you see? And I know when you were talking about your own experience and how young you were, about feeling just alone, and I'm sure that feeling of isolation when you're caring for a loved one and maybe you don't know where to look for help. What are some of the challenges that these caregivers and family members are facing that you guys are helping to alleviate?
Yeah, it's just definitely the extra support. So you'll hear a lot of times that the care usually falls on one child or one
Right.
individual, and they might have other siblings, but it's the asking for help. And then also knowing that this is something that you truly can handle. I just had a conversation yesterday with a caregiver, and she was kind of on the fence. And I said, I can't tell you what to do, but this is a conversation you have to have with yourself and be really open and honest on if this is something that you can take on, because we want to make sure that you are emotionally okay to do this journey, because
Right.
it's a big deal. And it's just caregivers asking for help. There's nothing wrong with asking for help. Everybody needs some time off. So the care team will very much support that caregiver in identifying somebody else, whether it's another family member, another friend, to give them that time off, to give them a break.
That's pretty cool. So are they actually working with them too on those types of strategies, like identifying somebody else to assist and
Yep.
maybe getting that time? Okay.
Yep, absolutely. And if it isn't a family member or a friend, maybe there's an agency that could put in some respite
Right.
help for that caregiver. It's really just talking through and letting them know that, there are other options and it is okay to ask for help.
Yeah. Now, when do you see people reaching out and finding you? Is this something that happens typically when people are already kind of in crisis and trying to figure out their next steps? Or is there a way for them to kind of get ahead of some of this?
That's a great question, and it's really important for people to get ahead of it. If, of course, being approved for the home care program for elders, there has to be that functional requirement component. So your loved one has to be needing help with an ADL, which is activities of daily living, whether that's help with bathing, dressing, transferring, mobility. But so many families don't even realize that they're doing this on a day-to-day basis already.
Yeah.
And because it is a little bit of a process to apply for the program and to be approved, I would say to, get on it as soon as that situation arises, because these are long-term services and supports that stay in place until the day the patient passes away, or they choose to go into an assisted living facility or not receive services, which, I mean, if they stay in place, I don't know why somebody would do that, but it's really
Right.
important. If they're in that moment and they're in that crisis moment, it's kind of hard because there is that approval process. So speaking with professionals, with communities across the state, it's really important because they have access to so many patients and other people that they can sometimes just offer this resource, and they could get it started right away.
Yeah, I mean, I think ideally it would be a part of that aging in place plan, right? Something that people are thinking about in advance of, I want to stay in my home as long as I can. And I'm healthy
Right.
now, but what are the resources if things start to go another way?
Absolutely.
Is it just that they need help with one ADL?
So for the home care program for elders, they really would need support with 2 ADLs or a diagnosis of Alzheimer's or dementia and require that supervision.
Okay.
So, but having that detailed conversation with these individuals and these families, they don't even realize, does your loved one use a walker? Do they use a cane? If they did not have that in place, there is going to be mobility issues.
Right.
Do you ever help them in and out of the home, in and out of the car? Helping them to walk safely. They ever need assistance taking a bath? Maybe just even helping to wash their back or getting their shoes and socks on. I mean, without you there, that wouldn't be happening, right? So
Yeah.
they don't give themselves enough credit. So having that really intimate conversation with them, they're like, oh yeah, I really am doing that. And we can get the process started.
So a lot of times people don't even realize that this could be an option for them.
Absolutely.
Okay. And so what is the biggest challenge for you guys to get people to know about the program?
Just people being receptive to hearing about the program. There's people that are really open to hearing about new resources because we want to offer them to other people. It's in our hearts to want to offer help to people. Others, it's just that's the barrier that I'm facing. I can go to 10 doctors' offices to try to get this program out, and 5 will open the door to me.
Yeah, gotcha.
And that's my job. It's just educating everyone in Connecticut the best way I can, just by presenting the program and letting people know about it.
Yeah, I mean, it definitely made sense when I heard from you. You reached out based on the fact that I work with the Medicare clients.
Absolutely.
So to get that information into more brokers' hands or people that work with seniors, it definitely makes a whole lot of sense.
Yep, I agree.
What an incredible resource. Now, are there any costs involved for somebody that's utilizing the program?
So again, with the home care program for elders, there's the financial criteria that has to be approved. Everybody that has an assessment completed will have a Medicaid application completed.
Okay.
If somebody qualifies for Medicaid, that is best case scenario because their budget for services is larger and they pay a 0% copay or 0% zero cost to any services that they receive. It's nothing that comes out of their pocket. Now, if somebody is over income for Medicaid or over asset for Medicaid, they can still receive these services, but go on as state funded. And at this time, it's a 3% copay of services in the state of Connecticut, which, I mean, they're receiving many services and just paying a 3% copay.
Okay. So you don't have to be on Medicaid in order to benefit.
Correct.
Okay.
Correct.
Understand. And then you mentioned that there's a stipend involved for the family caregiver. What does that look like?
So it is a daily rate. So a lot of times when you hire caregivers or you have ones from an agency, it's obviously a taxed hourly rate. This is a tax-free daily stipend rate. There's 4 levels of care, which is usually assigned at the assessment. After they do the assessment, they determine if the patient's level 1 through level 4, and that's pretty much on their ADLs and what they can do for themselves. So that would determine how much the caregiver gets paid for the daily rate. I usually say it's, tax-free a little over $2,000 a month.
Okay. Gotcha. So that also helps obviously for people who are struggling financially.
Absolutely. Absolutely.
Is there a certain minimum of hours that the caregiver needs to be there, or is there any tracking of that?
Nope. So that's another great question. So this caregiver is living with their loved one. They know what has to be done day in and day out. There's no set hours. What works for one individual might not apply to another individual. We have many caregivers that still have jobs.
Okay.
If their loved one, just needed help with showering in the evening and maybe getting dressed in the morning or the evening, but they're safe while they're gone. So it's case by case basis. Okay. And that's why it's so important to have that clinical oversight as well, because they're really in the home knowing what's going on and what the situation is.
So this is not somebody that needs to give up their career in order to go take care of their loved one.
Absolutely not. I mean, many caregivers are. If mom or dad was diagnosed with Alzheimer's or dementia, they needed that constant supervision. But in today's world, a lot of our caregivers are working from home as well. So,
okay. And so, I mean, that I always think about that, like how difficult it is, and I think you and I talked about too, like the concept of the sandwich generation, when you're raising kids, taking care of elderly parents, having a career, how difficult it is to coordinate and keep up with all of those things and the stress that comes along with that. This program seems to help people to manage that effectively. Is that right?
absolutely, absolutely. That's so wonderful that you said that. So yes, it's the sandwich generation. The largest demographic of caregivers are females in their 40s and 50s. We do have tons of sons and grandchildren, males, but that is the largest demographic. So, they're taking care of their own children while trying to care for their aging loved ones. And we want to make sure that they are taking care of themselves.
Well, it is so important that a program like this does get the attention that it deserves. As people are trying so hard to stay in their homes as much as possible. Being able to do that, if that's your wish, and able to do it in a healthy way so that it's not putting so much stress on your family members, is just really important. So we're happy that you're here, and we're happy to spread the word about the program. Are there any ways that people can reach out or find you? Any events that you're participating in?
Yeah, so my calendar's always chock full, especially during this time of year. We have a lot of health fairs going on around the state. It's particularly in southeastern Connecticut. I just did one at Dodd Stadium. There was a health and wellness fair. There's events everywhere that people can either Google and find out. And I try to attend those. There's a lot of food share distribution sites where communities will go to get some food assistance. I tend to go there as well. Anyone could reach me anytime with my cell phone number, which is 860-550-1728, or email me at cbrown@careforth.com. And anyone could also visit the website to learn more. Again, we are in 10 states with this program. So, maybe this program might speak to you if you have a family member living in a different state. So they can really just learn more about going to our website.
And a lot of times the barrier for people is they don't know if they're supposed to reach out or not. Should they, is it time? Is it not? Would you encourage people, if they have questions, just to make the phone call or send an email?
Absolutely. Absolutely. Yep. And I am more than happy to answer any questions.
Awesome. Were there any types of support systems like this when you were a caregiver for your mom?
Well, if there was, I did not know about it.
Yeah.
So I know that Careforth has been in Connecticut since 2014. That was the early 90s. And I just feel like our culture was different then. Not many people spoke about it. I just even see in school systems, I was going to school and I don't remember one teacher, one school social worker ever asking me. Of course, everyone knew growing up in a small town what happened to my family, but nobody ever asked how I felt or what was going on when I went home. Everyone kind of just stayed to themselves. I think nowadays there's such a focus on mental health and supporting each other and giving resources that we're doing a much better job of talking. So again, I was 9 years old, and on this program, you have to be a caregiver. You have to be 18. So that wouldn't have worked for me either.
Right. Yeah. Right.
But, there's, and that's the frustrating part. You'll get calls, and especially from spouses, and it's not a perfect system. The fact that you have to say that legally married spouses can't be caregivers, it's very frustrating. We are working to advocate for that to change at a state level. So we're hoping in the future that will happen. But we have to at least support those that can be supported, for sure.
Of course. So that advocacy is happening on a state-by-state basis?
Absolutely. Yep.
Okay. Well, I mean, what an amazing program to have. I know we probably need more of these types of things, so that we're getting to everybody who needs this type of assistance. But we appreciate you taking the time to be here and to tell our audience all about Careforth. We'll be sure that we're spreading the word as well. And if anyone is out there going to any of these health fairs, especially during this time of year, keep an eye out for Careforth in the logo and go by and say hello to Candice. Obviously, she's very open to talking to you, so don't be afraid to approach. And if you have questions, be sure to reach out to her. This is just such an important thing as people are trying hard to stay at home and to be healthy and to have, the caregivers have some sort of balance and support, especially emotionally, because that's just such an important part of all of it.
Absolutely. I agree.
Well, usually what we do to kind of wrap up our episodes, Candice, is we ask our guests to share a health hack. So this is something that you practice in your life that helps you to improve your physical, emotional, or financial well-being that you think our audience would benefit from.
Yes. So when you asked me to do that, I kind of had to really go through my day, and something that I do try to do on a daily basis that I feel is so important and helps with my emotional well-being is to shut off. I mean, through work, I'm looking at a computer all day. I'm answering a phone. We always have our iPhones in our hands, and we're on social media. I love to just shut off. I just walk away from it all. I go outside. I like to take walks. And that's my opportunity to kind of just appreciate nature and everything around me, listen to the sounds, listen to my own breath, be in my own thoughts. On those days that I don't get to taking a walk, it's just sitting outside in the backyard in a chair in the sun, but making sure that I shut off.
That's so important, to get away from those devices and all the noise that's in our lives, and to have those moments to just get grounded.
Yep, absolutely.
So that's a great one. I think a lot of people would benefit from doing that more often. Awesome. Well, Candice, thank you so much for being a guest on Sounds of Health. This was great that we were able to connect, and we will do our best to spread the word about Careforth and all the amazing work that you're doing.
Thank you, David.
All right. And thank all of you out there for listening. That's a wrap on another episode of Sounds of Health, brought to you by Nutmeg Insurance Advisors and recorded at the offices of Nutmeg Advisory Group. I'm your host, Dave MacNiven, and Sounds of Health is produced by Jason Carubia with music by Rob Hames. Every week, we bring you stories that inspire, empower, and help you upgrade your health. If you enjoy the show, please be sure to like, share, subscribe, and leave us a review. We love hearing from you, and we hope that you will all continue as an important part of our wellness community. Thanks for listening.